Hi, Strong Mom Society. So lower back pain is something that plagues many of my pregnant and postpartum clients. So I'm going to take you through some stretches and some exercises today to hopefully eliminate some of that back pain, get you more connected to proper breathing, core activation, getting you into neutral alignment with your spine, and keeping you moving forward. So the first thing we're going to do is start with that core breathing belly pump. I want you to come on down to your back. If you're pregnant and not entirely comfortable here, lay onto your side, or if you are comfortable, feel free to stay for as long as you feel good. So we're gonna roll down and just station those feet underneath you in a nice parallel position and bring your hands to your lower belly. I want you to take that nice big inhale so you feel your lower belly rise. And then as you exhale, feel that lower belly fall. So what you're trying to do is get your diaphragm on here, not that upper chest rising and falling as you breathe in and out. Now, as you breathe in, try to send that air all the way down to the bottom of the pelvis so you feel the pelvic floor muscles completely relax. And then as you exhale, I want you to think of those front and back sphincters in the pelvic floor. You're gonna close like you're stopping the flow of urine at the front, close at the back like you're stopping yourself from passing gas, and then gently lift up inside on that exhale. On that inhale, let those sphincters open, widen, lengthen, feel that breath go all the way down to the bottom of the pelvis. Exhale, close and lift up and in. Now, if your hand is still on your lower belly, as you take that pelvic floor lift or that Kegel, you might feel a little bit of muscle tension happen right here below the belly button. That's great. That's that transverse abdominis firing in combination with your pelvic floor. That's exactly what we want. These muscles are essential to keeping you out of back pain because we want the core to fire correctly to keep that strain out of your back when you're moving throughout the day. So we're gonna go a little bit deeper. As you inhale, release, exhale. Close and lift those pelvic floor muscles. Feel that connection across the lower abs, and then just imagine that you've got a nice tight corset or a zipper that comes all the way up. We wanna zip from the bottom to the top, never the top down. Inhale, let that all go. Pelvic floor relaxes, exhale, close and lift front and back. Feel that connection travel up the front of the body. One more time, inhale, release. Belly expands, exhale, close and lift. Now we're gonna go into a few stretches to help release some tension in the lower back before we start to move. So you're just gonna hug your knee into your chest. I've got my left knee in, right foot is still on the ground. Think of your left sits bone. You don't wanna hike this hip. I want you to think of that left sits bone wagging down towards your right sits bone. So we're keeping that pelvis in line. Take a nice core breathing belly breath here. And then go ahead and extend that right leg out straight. And you still want to think about those sits bones being in line, not hiking that left hip up. One more breath here. And go ahead and bring that foot down. We're going to head over to the other side. So hug your right knee into the chest. If you feel that right hip has popped up, anchor it down. Big belly breath in, tongue twister, and then exhale, and then extend that leg out long, big breath in, exhale, and let go. I'm gonna cross my right foot over, that's my left foot over my right knee, and you're just gonna pull back in a figure 4 stretch. Breathe in, feel that stretch down the outside of the left leg. And breathe out. If you're not comfortable on your back for this, you can pop up and do the stretch here from the seated position instead. And then you're gonna go ahead and switch over to the other side. So ankle over knee, keep some flexion in that foot to protect your knee joint. And then coming back down. We're gonna do a little reset for the SI joint. If you're, again, not comfortable on your back, pop up into a chair. You're gonna do this from a seated position instead. Otherwise, you're on your back. I want you to bring your knees up, pull your fists together, and crush your knees around those fists. I want you to squeeze in as hard as you can for 3, 2, 1, let go. Open up your palms to the outsides of your knees. Try to open your knees out like you're trying to separate them. Your hands won't let you. Pull your shoulders down your back. Hold here for 3, 2, 1. Back to that inside. Crush your fists for 3, 2, 1, and open up. Try to separate your knees. Push for 3, 2, and 1. Good. I want you to bring your feet down. Make sure they're in parallel. Connect in. Think of your big toe, your little toe, and your heel as an anchor. Press more weight down into your heel. Activate your scaps. So find that midline back connection. And I want you to lift up and down through your glute bridges. Think about your breath here. Inhale, exhale as you're lifting and lowering. Squeezing those glutes. We just did a little reset for our sacrum or SI joint with those squeezes and presses. Now what I want you to do is squeeze your glutes around those bones and try to keep them firing equally. So check in with your left and right glute. Make sure you feel both of them firing together and releasing together. 3 more. 3, 2, where's your breath? And 1. Stay up here. Give me a little squeeze, release, squeeze, release, squeeze, release. I'm just pressing down with my palms, trying to keep my chest open, trying to find that connection at the very center of my back, pressing into my heels so this doesn't get into my quads or my knees. Give me 5, 4, 3, 2, and 1. Bring yourself down, hug your knees into your chest, give yourself a little rock from side to side. Now I want you to connect with that breath, to roll yourself over, and we are gonna come up onto all fours. And from this all fours position, I want you to go through a tuck and a tilt with your pelvis. So a full cat-cow would look like extension and rounding through the spine. We're not gonna go into that full range of motion. I want you to think of having a pencil on the end of your tailbone, and your back is pretty stable, and you're just gonna draw a 1-inch line up and down with your tailbone. So you'll see that that movement is all coming from the pelvis. And you might even feel, if you're prone to low back pain, when you bring the pelvis up or bring it down, you might feel a little twinge. So what I want you to do is stick within the range of motion that feels good. Don't go to the place that causes any pain. And then as you do this, connect with your breath. Where is that belly breath in? Belly drops down towards the floor. Exhale. Start to find some scapular connection. So I'm looking for that midpoint right in the middle of the back so your shoulders aren't crunched up to your ears. And then I want you to take that pencil and I want you to draw a circle around a quarter. So what we're trying to do here is mobilize the pelvis. Get us out of that tension. When we have low back pain, we tend to hold tension and gripping in this area of our bodies, and that just causes more pain. Reverse, take that circle around in the other direction. Still trying to keep those scaps on. I'm still thinking about that belly breath. And then I want you to just wag the tail right to left. So I've got that pencil and I'm drawing a horizontal line to the right and left. And then I want you to sit all the way back in child's pose. Extend those arms out. Nice big breath in. As you breathe in, let your belly drop down towards the floor. And then I want you to exhale, lift your pelvic floor, wrap your core, find your scaps. See if you can bring yourself back up into neutral. Check in with your pelvis here. If you tend to flip your pelvis up or come out into this position and tuck your pelvis under, I want you to find that place that's the happy medium right in the middle. This is going to tell you a little bit about your movement patterns. You know, if you go from one position, you transition to a new one, your body will hold the position that it likes to go into. So you're just checking in here with a few rock backs and forward to see, do you rock forward and try to tuck your tail under, or do you walk forward and try to flip your tailbone up? Can you find that place in the middle? Shoulders are down, arms are connected to your back, lower belly is lifted. Inhale, let go. Take that a few more times. We're just trying to find neutral pelvis here. This is gonna make a huge difference when we come up to standing and we're trying to get ourselves out of lower back pain. One more time, inhale back, exhale, forward. Now we're gonna come up to a full kneeling position. If you need to put some padding underneath your knees, grab a blanket, pillow, maybe fold your mat up an extra layer. And I want you to bring your hands to your shoulders. This is gonna tell you if you're using that upper chest breath or if you're able to get that breath in and out of the lower belly. We're gonna take a side bend and we are gonna activate those lower core muscles to support the back and get our obliques on in the side bend. So here, inhale, Did your belly go out or did your shoulders rise? If your shoulders rose, give it another try. Take a breath in, see if you can get your belly to extend, pelvic floor to relax. Exhale, close and lift, front and back, stopping the flow of urine, stopping gas, lifting them up, finding that lower belly wrap, and then you're gonna take a side bend over and back up again. Inhale, belly goes out, not shoulders. Exhale, close and lift, wrap those core muscles first, and then side bend to the other side. Inhale, belly out, exhale, pelvic floor up, belly in, side bend. Now as you take this exercise right to left, see where you're feeling this in your body. And again, check in with that pelvis. If you tend to tuck, this might cause some pain. If you tend to overarch, that may cause some pain. You wanna find that place where your tailbone's dropping straight down, like there's a weight, it's nice and heavy, you're not tucked, you're not tilted. Lifting, wrapping, training your body to go into that neutral position with that proper core activation before you bend. We bend in our lives a million times a day. So if you're bending with this misalignment or the core hanging out, you're gonna cause that back pain. One more. Exhale. Now we're gonna head into rotation. Same thing. Neutral pelvis, wrap, lift, then we rotate. We're trying to get those obliques to fire. Inhale, exhale, rotate. Some of us when we rotate will kind of tuck to protect lower back pain, or we go into a big arch. So check in, is your pelvis neutral? Can you get this on? And then turn. Inhale, exhale, rotate. One more time to the right. One more time to the left. Good, and then come back to center. We're gonna bring one leg forward here, and I want you to just tuck and tilt that pelvis again. That neutral pelvis that I keep talking about is a huge culprit when it comes to the pain that we feel in that low back area. You know, because when our pelvis is tucked under, we tend to grip up the quads and the hip flexors, causing tension at the front of the body, pressure on the low back. And same, when we're here, we're flipped up, belly spills out. We can't connect to the core. That puts pressure on the low back as well. So we want to make sure that we're training through that full range of motion in the pelvis, tuck and tilt. And let's do the other side. And making sure that we don't feel stuck or too tight in either one of those directions. Think about your scaps here as well, that midpoint in the back. That's where your arms start. And then what I want you to do is shift your weight into that front heel. I've even got my toes lifted a little bit, so I'm really pressing down into that heel. Sticking your butt out. So if you're a tucker, untuck, and then press up to come up to standing. I'm gonna go back down on that same leg. I'm gonna take that leg behind me. If you're tucked here, stick your butt out and lower down with your weight pressing into that front heel. I like to call these baby get-ups. You can even imagine that you've got a baby here in your chest and you're gonna get up from that position using your glutes, not straining your back or putting a ton of tension into your quads. The key here is to stick that butt out, drive into your front heel to stand. Same thing as you lower. And I like to use that mantra, switch sides, blow before you go. So I'm gonna shift in and out of this front leg. I'm making sure that my pelvis is not locked into either of those tucked or tilted positions. Tuck those back toes, press down into your heel, find your glute on that front leg to stand. And then same thing, push it back, stick your butt out, drive into your heel to lower. If you wanna try with that baby, you can even grab a weight here, press, blow out, wrap your core, find your glute to stand. Exhale, wrap the core, stick your butt out, find that glute to lower. One more time. The other thing to think about here is not letting those shoulders round forward because that's gonna strain the back as well. So find that scapular connection to stand, exhale, to lower. Great, get yourself up. We are all the way up to standing now. Close your eyes, just shake everything out for a second and connect again with that low belly breath. Breathing in, trying to feel the pelvic floor relax, breathing out. And I want you to do a posture check here. Your anchors are your big toe, your little toe, your heel. Knees are not locked out. Look what that did to the back of my pelvis. So tiny bend. Glutes are not on. If they were, I'd be here. And also pelvic floor. This position also pulls up on the front of the pelvic floor. So you want to think about breathing in, relaxing that pelvic floor. Let your sits bones go wide. And then as you exhale, that work all happens internally without having to move the bones. So you're just going to take a core breathing belly pump. Exhale, find that scapular connection on your back. And we're going to use that to head to a wall, and we're going to do a wall slide. So I'm going to show you profile here. You're going to set yourself up into a wall where your forearms are pressing, your elbows are extended right out from your shoulders. You're going to use that core breathing belly pump to lift and lower the arms. So your inhale here is a release. As you exhale, you find that lower core activation. You pull your scaps down, and you try not to let your shoulders come up into your ears as you lift and lower. So here is the back position. I'm thinking about neutral pelvis. Nice big belly breath in, exhale. Pelvic floor lifts, lower abs wrap. I'm finding that connection right here as I lift, slide these up the wall, lower them back down. Inhale, release, exhale, pelvic floor, lower abs, scaps pull down so my shoulders don't rise as I slide my arms up the wall and back down. I'm going to do this profile for you. Inhale, you keep going. Exhale, pelvic floor, lower abs. Pull those scaps down as you lift and lower. Here's the front view. Inhale, release, belly lets go. Exhale, pelvic floor, lower abs, scaps pull down as you lift and lower. Good. Doesn't look like much of an exercise, but it is work when you get those scaps on and you start to connect the scaps with that pelvic floor and lower core integration. From here, you still have those three anchors, big toe, little toe, heel, hands on your hips, and we're gonna go in and out of that tuck and tilt that we did in those other positions. So tailbone under, you feel how your glutes kick on, from the pelvic floor turns on, and then inhale, everything turns off, belly spills out the front. Now, just like what we did when we were down, I want you to find that range of motion that doesn't cause any pain. If you have pain here, I don't want you to go that far. If you have pain way back here, try to eliminate that crunch in the low back. Connecting this to your low belly breath. One more time. Great. I want you to touch your sits bones with your hands. Your sits bones are those two bony points that you sit on. Think of yourself as sitting on a really hard chair, and if you were to rock back and forth, those bony points are your sits bones. So you're just gonna imagine where they are. And then as you hinge forward, you're gonna think that they go out and back and in and under. Now as you take this motion or this hinge, you're gonna think about where do you wanna inhale, where do you wanna exhale. There is no wrong way or no correct answer for that. So if you wanna inhale down, do it. If you wanna exhale down, do it. But I want you to stay connected to that low belly breath. And you're just feeling how your sits bones move out and back, butt really sticks out, and in and under. We bend at the hips a million times a day. So when we come down, a lot of us tend to round through the upper back. This is all pressure right here. Every time you lean down to pick up a baby, a sock, laundry, anything, I want you to think about getting your sits bones out and back behind you, then in and under as you stand. You're gonna reprogram that here in this workout so you really feel those mechanics. You feel a little stretch down the back of your hamstrings. You feel some glute activation. So next time you go to pick something up off the floor, don't be afraid to hinge at the hips. Get your butt out and then get yourself down. We're gonna take this into a proper squat. If you have a chair that you get up and down out of a lot, take yourself over to that chair and try this there. Otherwise, we're just gonna bend a little more at the knees and find your breath connection. Where's your breath in? Where's your breath out? I'm really driving into my heels, so I stay connected from my sits bones all the way up the back of my legs into my glutes. And I'm really trying to figure out where's that range of motion in my pelvis that doesn't cause any back pain. And then connect to those scaps, because if you're rounding forward as you come down, that's gonna change the feel that you have in your back. Or if you're way out here, that's also gonna put some back pain into your lower back. 3 more, 3, ooh, 2, and last one. Good, shake it out. We did that side bend rotation from a kneeling position, now you're up. What's the difference? Well, sometimes we can breathe correctly on a low level or lying down, kneeling, but then when we get up to standing, it gets harder to utilize that diaphragmatic breath when our diaphragm is not very strong. So here I'm gonna make you use it. We're gonna inhale, did your shoulders rise, and get that belly to expand. Exhale, side bend, inhale, rotation. So a little combo movement there. We're gonna stay on the same side. Inhale, let everything go. You're looking for neutral pelvis. Exhale, close and lift, wrap those lower abs, take the side bend first. Inhale, into the low belly, exhale. Pelvic floor, lower abs, rotate. So you're really looking for that oblique activation. You might even feel it on both sides. Inhale, side bend. Inhale, rotate. Take it to the other side. Inhale, close the pelvic floor, wrap the lower abs, side bend to the opposite side. Inhale, release the belly, exhale, rotate. Breathe in, exhale. If you need to take these at a slower pace, because I'm asking your brain to do a lot, lift, wrap, engage before you move. Inhale, exhale. Inhale, low belly breath. Exhale, rotation. One more time. Inhale, exhale. Pelvic floor, lower abs, engaging the core. Inhale, exhale. Pelvic floor, lower abs, rotation, and come back to center. Good. Take your hands on your hips. We're just gonna circle around a little bit in both directions. Again, trying to mobilize the pelvis, because when we have pain, we tend to hold tension. Tension creates more pain. And then give me a flip up and back. Just trying to stay connected to that low belly breath. If you need something to hold for your balance, grab a wall, a chair, a bookshelf, just take a standing quad stretch. Breathe into that stretch. Then you're gonna take that same leg, you're gonna cross your ankle over your knee, and you're gonna sit back in this chair or this figure 4. Feel that stretch down the back of the leg. And then we're gonna take it over to the other side. So standing quad stretch, grab your heel towards your butt, drop that knee straight down. Low belly breath. And then cross that ankle over your knee, sit back. Feeling that stretch here. So that standing quad stretch gets the quads, the hip flexors to relax if you're a tucker. And then I'm gonna have you come down and we're gonna do the hamstrings. I want you to come to a kneeling position. Extend your leg out in front of you. Try to take your sits bones straight back, and you're just gonna walk your hands down to either side. Flex those toes. Try to bring your nose down towards your knee. If you tend to extend, or you've got an anterior tilt where your tailbone flips up, you might have really tight hamstrings. If you can't reach the floor, grab yourself a stack of books, some pillows, some yoga blocks are great here to get yourself down into this stretch. And then we're gonna flip over to the other side. Leg is out, sits bones go back. You might find that one sits bone really wants to pull forward when we've got some tightness here. Try to stick your butt out. Think of a long line of energy from the top of your head through your spine, out your tailbone. And then we are just gonna come back down. I want you to either take a side lying position or lay back down on your back. Bring your hands to your belly, reconnect to that belly breath. So much about getting out of pain is also learning how to release and let go. And we often think that we have to strengthen and tighten things. And for a lot of my clients, what they need to do is just learn how to let go of tension. You know, they tend to hold tension in their pelvic floor, which causes more of that tuck, or hold tension in their hip flexors, which causes more of that anterior tilt. So, you know, taking the time before, after your workout, or start or ending your day with a few low belly breaths where you're just connecting to that inhale, feel the rise, exhale, feel the fall. Don't worry about any kind of contraction or Kegel or anything. You're really just, take any position. This could be full on relaxation pose where you just take a minute, set a timer on your phone, and let go. So I hope this helps get you out of some lower back pain. If you have any questions, please don't hesitate to email me. I'm more than happy to talk or to talk through some exercises and troubleshooting with you. And let's keep you moving and feeling really good.